Consultation is the first step in the patient's pathway. When I was at medical school, quite a long time ago now, we were taught that about 85% of the information that you need in order to reach a diagnosis comes from the patient's history, from their story. So it's essential, an essential first step during the consultation, to listen to the patient, to hear what their symptoms are, when they started, how they started, what those symptoms are, what makes them worse, what makes them better, and to understand also the impact of those symptoms upon the patient's life, because everybody is different, and what for one person may be negligible to another may be really, really difficult to live with. If people have had previous investigations, previous tests, then obviously that will help inform us what the overall picture is, and that may be very, very helpful, and we'd want to know the results of the previous tests. And we'd obviously also want to understand what treatment has already been undertaken and whether that was successful or not. And then of course we also want to understand the rest of the patient's history. Do they have any other illnesses? Have they had previous surgery? Do they take drugs? If so, what those drugs are. Also other social history, because of course what people do for a living can be really important in understanding the context of the impact of their symptoms upon what they do. So for me, the most important part of the consultation is really understanding what the patient's symptoms are, what they want to achieve, and to start the process of an informed discussion between whoever the clinician is and the patient themselves to understand what the objectives are going to be.